Okay, we are demonstrating the crusting method on the skin of a irritated peristomal abdomen here. So we are first going to start by using our clean skin. We have taken off our old pouch and we have taken tap water on some gauze and we have cleaned the stoma and the skin surrounding. When that's all clean without any stool or urine, depending on your stoma, we will pat dry. This tissue is just like the inside of your cheek, so a little blood is normal if you see that on your gauze when you're cleaning and drying. Now to begin the crusting, what we're going to do is make a layer of crust. Some people will call this a glaze. So what we're going to do is take our stoma adhesive powder and sprinkle it or spray it onto the skin that is broken, open, weeping, and shiny. That makes it difficult to stick adhesive. So what we're going to do is make it a stickable surface. So we're gonna spray it on. Now, if your patient tolerates it, it's okay to rub it in a little bit. You don't have to, but it just helps distribute that powder. You can also use dry gauze to do that and then help get off the excess. And what you're left with is a sticky bit of powder over those weepy, sore, raw areas of skin where that breakdown has occurred. From here, what we're going to do is take a skin barrier film. Now, we have these in stick form. They also come in spray or pad. Whichever type you have, I want you, mostly with the stick here at the VA, go ahead and dab that skin prep down on that powder wherever that skin is broken down where you sprayed the powder. And powder first, dab second. It dries into a small film that is a new kind of layer of skin that allows your next pouch to stick on. And we're going to repeat that 3 times. And we dab everywhere. You might have to use more than one skin prep wand as they only contain 1 milliliter of fluid for a large area. You want to get in those creases and along all those body curvature areas of topography. And so I'm going to open another one because mine has dried off. So we've got 2 layers. We're going to do 1 more layer. And then if you were to feel this, all that moisture would be absorbed and you would have a dry surface to work with. So we're just gonna spread that around. It's okay if your powder gets on your stoma. It will just kind of dissolve eventually and slough into the bag, which is great. But for here, we have dabbed anywhere where our adhesive is going to go. Now just around the edges, I'll swipe where the tape will land, but the dabbing really seals it in. And then once everything is dry, you should have a workable surface. So we will go ahead and measure our stoma with our measuring guide. If you don't have a circular measuring guide, I recommend measuring the diameter in millimeters so that you can cut out a nice pouch surface. I'm gonna do 1 3/4, so I just have a little hair of belly skin showing around there. Hairline. So I open the bag like a bag of chips so that I am not tempted to cut through that plastic with my curved scissors from a debridement kit. I'm going in through the existing pilot hole and I'm going to cut the circle of the size that I've measured. Now, because it's easier to see, what I'm going to do for the purpose of this video and your learning is highlight that cutout with a dark marker, and you can see there where I'm going to cut. So we go in that hole and we, without making a jagged edge, cut a smooth amount of this hydrocolloid adhesive barrier off in a nice big piece. Sometimes you can do in small pieces by kind of darting these edges and they kind of fall off, and that's easy too. However, you can get your circle cut smoothly. And then, before I take the backing of this pouch off, I'm going to double check that this fits. And so I will just kind of check that I can see that belly and that I can get the entire stoma visible through the pouch. Now that I've determined that, I will go ahead and take off this paper backing, and we can worry about these tape borders later, but pro tip here, if you dog ear these, they're much easier to pull off later, but they take away all the stickiness for now by leaving them on until you're totally ready to remove them. So go ahead and put your pouch on. Now with a nice flat, warm hand, I want you or your patient to press down on this pouch where that adhesive is to kind of meld it down to the belly, about 30 seconds or so. And then you can go ahead and pull those tape borders off where we dog-eared them, and those can stick down nice and smooth. And the other side. And there you have a pouch change with crusting. Now we want to verify that this is a urostomy pouch. We would have the gold drop flowing for on, flow, drain. We're going to turn it right off because we don't have any bedside drainage bag attached there, but we know the urine will be contained.